Hi, I'm Timmons, a family nurse practitioner student at Francis Marion University, and today I'm going to talk to you about Parkinson's disease. My objectives are explain Parkinson's pathophysiology, risk factors, symptoms, and diagnosis, stages of Parkinson's disease, treatment and geriatric considerations, and comprehensive approach to care. Pathophysiology. Parkinson's disease is characterized by the progressive degeneration of dopamine-producing neurons in the part of the brain responsible for controlling movement. This loss of dopamine leads to an imbalance in the brain's motor circuits, causing the hallmark symptoms of tremor, rigidity, and bradykinesia, also known as Parkinsonism. Types: idiopathic, affects people around 60 years old and older, most common type. Early onset, affects people 21 to 50 years old. This is rare. Familial, caused by inherited gene mutations. Secondary, occurs as a result of an underlying process or factor, such as drugs, head trauma, toxins, etc. Risk factors: age, 60 years old and older, male gender, family history, environmental, and neuroleptic medications. Diagnosis and symptoms. Diagnosis is based on distinctive clinical features discerned from history and neurologic examination and supported by an unequivocal therapeutic response to therapy with dopaminergic replacement medication. Bradykinesia must be documented for diagnosis in rigidity or stiffness or resting tremor. Gold standard for diagnosis is by an expert clinician specialist, such as a neurologist. There are no physiologic, radiologic, or blood tests to confirm the clinical diagnosis of PD. Supportive criteria: beneficial response to dopamine therapy, levodopa-induced dyskinesia, documented resting tremor of a limb. Important to note, the absence of an observable response to high-dose levodopa therapy greater than 1,000 milligrams daily in patients with at least a moderate severity of Parkinsonism makes a diagnosis of Parkinson's disease extremely unlikely. 5 stages of Parkinson's disease. Stage 1, tremors occur on one side of the body, usually the dominant side. Symptoms do not interfere with daily activities. As the stage of degeneration progresses, it progresses to stage 5 with inability to stand, walk, eat, or swallow. The patient is completely dependent on the caregiver. Pharmacologic treatments: levodopa, most commonly in the form of carbidopa, levodopa, Sinemet. This is the standard treatment, pharmacologic treatment, it's first-line treatment. All are considered to be symptomatic therapies, and none have been established as a disease-modifying or neuroprotective. There is no cure for Parkinson's disease. Selection is based on patient characteristics, such as age and comorbidities, disease severity, and drug efficacy and side effects. In addition to the dopaminergic therapies, anticholinergic drugs are also rarely used for tremor management in select patients with early PD. We do not like to use anticholinergic drugs with the elderly. The decision to initiate symptomatic medical therapy in patients with PD is determined by the degree to which symptoms interfere with functioning or impair quality of life. The timing of this decision varies greatly among patients, but is influenced by a number of factors, such as the effect on the dominant hand, the degree to which the disease interferes with work, ADLs, social or leisure activities, the significance of bradykinesia or gait disturbance. Non-pharmacologic treatment: social and emotional support groups, peer mentoring, social work and psychology referral, exercise and physical therapy, speech therapy, occupational therapy. Geriatric considerations. We should always address issues such as poor nutrition and weight loss, bone health and oral health, affordability of medications and referrals. Interdisciplinary team collaboration. We should collaborate with neurologists, physical therapists, occupational therapists, and speech therapists. It's very common for patients with Parkinson's disease to lose the ability to communicate, which is very important for their psychological and their health. Their overall ability to communicate is very important. Social workers and dietitians ensure culturally competent care and address diverse patient backgrounds. Utilizing health informatics. We should use health informatics to track patients' progress, manage medications, communicate effectively with the care team. Cautionary notes. Always consider patient autonomy and safety when making treatment decisions for these patients. Be aware of the ethical dilemmas that may arise in treatment planning. Regularly update patient records to reflect changes in conditions and treatment responses to the interdisciplinary team. Schedule interdisciplinary team meetings to ensure comprehensive care and communication. Utilize checklists for referrals and follow-ups to streamline processes. These are my references. Thank you.